you will have practical. So you'll have to get with her because I know that usually we'll ask you where you want to go, DHR or heart clinic or wherever they're sending you at this. Cornerstone, I think, is another one too. So yeah, so you can get with her on that. But I think some of you will be taking classes in summer too.
Yeah.
So, and I think the practicum is in summer, so that I have nothing to do with that, so, you'll have to reach out to her.
I believe we're having a meeting March the 4th.
Oh, okay.
To go over practical questions and
Okay,
everything.
good. Yay.
But
And-
is that over the phone or something?
It's on Teams. Yeah, it's on
And Teams? Yeah. Oh, yeah, once you start working, we just had a Teams today at Driscoll anyways, we have Teams all the time. And sometimes they wanna see you and sometimes they don't, thank God they didn't wanna see us today.
Is this still part of the practicum or no?
They just opened, so no. And they actually don't really have like a medical records, you know, cause all the records are online, so there really isn't any records. And actually, I went to the hospital just to check it out after orientation. Let's just say that their little room is probably from there to about a little bit smaller than our room. And it's just a little section and it has a supervisor, I guess somebody that actually will answer the phone, and then I don't even know who the other person is. So, so yeah, there's not gonna be nothing for you to do there yet, but, and maybe at some point, once I know they're getting ready to do a pediatric residency, you know, that would be starting next year, cause I inquired about that too, but they talked about it today at our meeting, so. They wanna start off with that, cause they need more doctors, but, maybe someday, some students will go over there, but. And then the other thing was she had sent out an announcement. They're having an open house on Saturday, so if you can help out with that, sometimes she gives brownie points, I don't know. But, and then you should have got that other announcement, I think somebody mentioned that about that meeting, so. You should have that there. Okay, yeah, the clinical affairs information session, so that would be on March the 4th at 4 p.m. So I guess you'll be using your laptops.
Our phones.
Some students had some questions on the chapter 18 quiz. Regards to number 7 on the assignment of the weeks of gestation and I think it was a Z code for the delivery. If you transpose them, meaning that you put them backwards, I will still give you credit because we had that situation last year and I was trying to investigate, like, do you have to put them in a certain order? The mama code always goes first, obviously, but the other codes, like those codes, it doesn't matter at this point. I know my 3M sequences that way, so that's why I set it up that way. But again, it depends where you work and how they want those sequenced. So it would always depend on the facility you're at. But here, I will give credit that the codes are correct. But the mommy code will go first, and then the hypertension code goes second, and then the Z code, okay? But you can always reach out to me if you're like, miss, this is right, I know it's right, okay, check it. I have no problem with that, just, send me a text or, message me on Blackboard and I'll get your message, okay? Any other questions right now? So we will have a test on chapter 18, the pregnancy chapter. I realize that spring break is coming up and I need to get one more test in before y'all take off on me, so. We will have it next week because I did want to do it the week before spring break, but I find that students have already scheduled their flight out, and you might not even show up to class that week. So I anticipate that you're already in your little spring break mode. I know how it is. I used to go to college. So we'll have the test next week. But before we leave, I'll allow some time to let you know what's on the test, okay? So now that we took care of mom, we will now be coding the baby charts, okay? And since working at Driscoll, well, it's a whole new world for me, because now I actually have all these infant charts and children's charts. So a little bit more familiar with those codes than I want to be, but.
Oh, goodness.
So if you like that realm, then that might be the job for you. Yes.
Sign-in sheet?
Oh, sorry. Yes, I haven't even taken anything out. But Miss Reese, unfortunately, does not like children's charts, and I have applied somewhere else. The good thing about being a coder and have done it for years is you can move anywhere and get a job anywhere. But the job that I want, or am hoping to get, 75 other people applied too. So you need to remember that you're not the only ones graduating, right? And I have to compete with the younger generation, but I do have a one up on them since I have more years of experience. But again, you never know what the employer is looking for. At Driscoll, we have a bunch of students that just graduated. They are willing to train you there. So that's good, right? And then there's other people that know. We just gotta keep going, and we need people that already know how to do it. So that's some places, right? But okay. There you go. Thank you for the reminder. So for this chapter 19, it's a very, very small chapter, so there will only be one little assignment in there. You're like, yay! I know. Okay, so chapter 19 starts on page 533, and so this would be the newborn codes. We have a few guidelines, not too many, so that's a good thing. Okay, so chapter 19, certain conditions originating in the perinatal period. And the codes would be from P00 through P96. I'm reading this out of the book. The learning objectives describe the organization of the conditions and codes included in ICD-10-CM chapter 16, certain conditions originating in the perinatal period. So that just means that within the first 28 days, maybe the child was born with a heart defect, or sometimes they're born with congenital defects, but we'll cover congenital defects in the next chapter, okay? So, define the newborn or perinatal period. Summarize the circumstances in which a code from chapter 16 of ICD-10-CM can be assigned in terms of age of the patient who has the condition. So I learned really quick at Driscoll that it doesn't matter if I'm 10 years old, some of the P codes still apply, okay? Yes, some of the P, which means you still have that lingering condition, right? You might have had the heart surgery, but you might have to go back 5 years later to have something else done, so they will still pick up the P code. Okay, so you'll see right now what I'm talking about. But yeah, I just thought that was a little weird too, but as long as the 3M doesn't kick it out and give you an edit, then you can assign it, So yeah, we have to follow the guidelines too. Identify the types of conditions classified in ICD-10-CM categories, P00 through P04, newborn affected by maternal factors and by complications of pregnancy, labor, and delivery. So again, if mom was a smoker, that could have affected the child. If the mom was a drug addict or drank alcohol, they could have got something with that, okay? So again, it's no more mommy codes, but now whatever she did could affect the child. So we have codes for that. Describe the circumstances in which codes from ICD-10-CM categories P05 through P08 are used on a newborn or perinatal, including weeks of gestation and birth weight. I have a lot of infants that come in for follow-up because let's say they were a preemie, so they are watching them maybe on a weekly or monthly basis, making sure they are growing like they're supposed to, if they need to modify the, give them more milk or less milk or whatever the intake is, because some of them have gastrostomy tubes, so you have to adjust things, so that's where those codes come in. Explain the term meconium and describe the conditions associated with the passage of meconium. So that basically is the baby's first, I want to use the correct, yes, but it's the first poop.
Bowel.
Now, sometimes they'll defecate, thank you. Did everybody sign in? I hope so. Okay. Before they're born, and if they swallow it, that could be really bad. Okay, so we're going to discuss conditions like that. Okay. Review the types of respiratory infections and cardiac dysrhythmias that can occur in the newborn and perinatal infants. Assign ICD-10-CM codes for certain conditions originating in the perinatal period, and assign the ICD-10-PC as procedure codes related to the perinatal conditions. Okay, so you have a few key terms down there in your book. You'll find the definitions to that in your book, of course. So the codes, I'm on page 534. Underneath all those codes, they've already sectioned them out for you, but we'll be going over those as I'm reading the PowerPoint. So the codes in this chapter describe conditions that began before birth or develop during the first 28 days of life. That is considered the perinatal period. Okay. After that, yes, you're still a baby, but you no longer fall under to this perinatal. Does that make sense? So if I was just a baby and maybe I was throwing up, right? Then mom would take me in, and depending on what it is, there could be a P code for that. So if it's within the first 28 days, you will be using a P code instead of a regular vomiting code. Does that make sense? Okay. So it doesn't mean that every condition that is out there will have a P code, okay? But if it does, jaundice especially, newborns usually have jaundice, there's a P code for that. So instead of using the jaundice code, like a regular adult code, right, or a child, more than 28 days, then you would use the P code, okay?
I'm sorry, Mom, you're saying P, right? Not
Yeah,
B?
P,
Okay.
yeah, because these codes are P codes.
Okay, sorry.
So that's the other thing too, when you're studying for your test, it's good to know what codes you're using. You found out that the I codes have to do with the heart. It kind of makes it faster for you to, like, if you're on that test and you're taking that CCS exam, you'll be able to narrow them down faster because you already know, my E codes are the diabetes codes or endocrine codes. You see what I'm saying? So each chapter has a specific letter, and that's just a little trick, right? Or a little tip to kind of be able to find those faster. Okay, so these are not congenital conditions again. So like I said, the congenital codes are Q codes. That would be the next chapter that we'll be working on. So the congenital condition codes are found in chapter 17 of the ICD-10-CM. The conditions that develop in the perinatal period may continue to exist past the first 28 days of life and can be coded regardless of the patient's age. So that's what I was saying, that I do see a lot of patients. They might be 6 or 10 years old, but the P code is going to follow them as long as they are still being treated for that disease. Does that make sense? So they're still being treated for it. Apparently it never went away, or they just, they're just going to keep track of them until, so it doesn't matter if he's 20 years old, he's still going to have a P code, believe it or not. So that will follow you, yes, all the way to adulthood, okay? Okay, so just make sure you kind of highlight that area, because, yes, I was at first when I was like, P code, right? When I was using them, I was like, but the 3M was taking them, okay, so I was using them. So here on the blackboard, has those conditions, separated. So the P00 through the P04, newborn affected by maternal factors and complications of pregnancy, labor, and delivery. P05 through P08, disorders of newborn related to the length of gestation and fetal growth. P09, abnormal findings on the neonatal screening. So they'll do that, I think it's a PKU or something like that. They'll poke the little ankle, they'll draw the blood, send it in, they find anything. So that would fall under some of those categories. P10 through P15, birth trauma. Again, remember that maybe his head got stuck in the canal, they couldn't pull him out, they used the forceps, and maybe they did something to him, not because they did it on purpose, but because they were just trying to get him out. So things happen. So we have codes for that. And then we have P19 through P29, respiratory and cardiovascular disorders. So we'll be discussing those. P35 through P39, infections specific to the perinatal period. Yes, even the baby can get sepsis. So again, we'll have a P code for that. P50 through P61, hemorrhagic and hematological disorders, blood disorders. P70 through P74, transitory endocrine and metabolic disorders. So sometimes, not always, I haven't seen an actual newborn come out with diabetes, but again, depending on what's going on with mom, that could be transferred, right? So P76 through P78, digestive system disorders of newborn. P80 through P83, integument and temperature regulation. P84, other problems, because remember we have other codes. We can't have a code for everything, but we can pilot in that little area. And then P90 through P96, other disorders originated in the perinatal period. So get out your blue IC10CM coding book so I can show you that little bitty section in here. It's super teeny tiny, but if you look on page 952 and 953, on 952 you'll see the guidelines that we're going to go over in a minute. That's why I tell you, do not panic in a test. If you forget a rule or how to sequence, you go basically to your guidelines, okay? So that little section is where you would be looking, well, once we look them up, right? We will be going over some in a minute. Where's my pencil? Of course, I don't have a sharpened pencil. Oh, here we go. Okay. So again, codes in this chapter describe conditions that begin before birth or develop during the first 28 days of life, which is considered the perinatal period. These are not congenital codes, but you can use obviously perinatal and congenital codes together, okay? So just to describe his or her whole life, you know, so you can use as many codes as you want. Again, they might not all be P codes. Conditions that develop during the perinatal period may continue to exist past the first 28 days of life and can be coded regardless of the patient's age. So chapter 16 codes are only for use on the newborn or infant record, never on the maternal record. So again, I cannot put a P code on mommy's, okay? It will edit out. Same thing and vice versa. If I try to use a mom code on the newborn, it will edit out, okay? This is on the 3M. In your book was good luck, okay? Just remember the rules. So remember that mommy codes on mommy record and newborn codes on newborn record, okay? If the condition originated in the perinatal period and continued through the life of the child, the perinatal code should continue to be used regardless of the age of the patient. So again, if the doctor mentions it, we're never looking for something to code, okay? Should already be documented in the record, so if he mentions the P code, you code it as such, okay? When both birth weight and gestational age of the newborn are available, both should be coded with the birth weight sequence before the gestational age. So what does that mean? Can't remember off the top of my head, but I think from 37 weeks all the way to 39, that's a normal delivery. Anything before that will have a prematurity code. Okay, so we're gonna work on those in a minute. Okay, so then you would have, let's say they were 35-week preemie, so there's a code for that. And then somewhere on the record, it should give how much they weigh. So then you would also add that P code too. But again, we're gonna look for those in a minute. Okay. P08.21 note states newborn with gestation period over 40 completed weeks to 42 completed weeks. So remember, the normal is 39. After that, they only have that one code. They will cover either the 40th, the 41st, or the 42nd week, okay? P00 through P04 codes from these categories are for use when the listed maternal conditions are specified as the cause of confirmed morbidity or potential morbidity which have their origin in the perinatal period before birth through the first 28 days of birth. On page 535, I'm gonna go over the guidelines in the book. So chapter 16, certain conditions originating in the perinatal period, again, for it to sink in, for coding and reporting purposes, the perinatal period is defined as before birth through the 28th day following birth, and the following guidelines are provided for reporting purposes. So we have a guideline 1.C.16.A, which is just stating general perinatal rules. Guideline 1.C.16.8.1, use of the chapter 16 codes. Again, codes in this chapter are never for use on the maternal record, so just remember M for mom. Codes from chapter 15, the obstetric chapter, are never permitted on the newborn record. And then chapter 16 codes may be used throughout the life of the patient if the condition is still present. Guideline 1.C.16.82, principal diagnosis for birth record. When coding the birth episode in a newborn record, assign a code from category Z38, live-born infants according to the place of birth and type of delivery as the principal diagnosis, okay? A code from category Z38 is assigned only once, so that you're gonna assign that when they're born, okay? To a newborn at the time of birth. If a newborn is transferred to another institution, because that does happen, let's say your baby was born in Harlingen and he had a heart defect. Well, we're going to transfer to Driscoll, right? Because now we have one here. They don't have to go to Corpus anymore. They're going to go straight to Edinburgh. So when Driscoll gets the baby, they cannot use that Z code because he was not born there. Does that make sense for that code? Okay. A code from category Z38 should not be used at the receiving hospital, and a code from category Z38 is used only on the newborn record, and again, not on the mother's record. Okay. So let's go to that little section in your coding book just so you can see what that's going to look like. So go to newborn. I think we had used that maybe last week. I don't remember. Okay, Okay, so if you go to newborn in your coding book on page 245, you have a Z38.2 for an infant live born single. Under that, if they're affected by anything, notice that we already have the start of the P codes there, okay? Okay, if you go to the next page 246, there's still some more P codes again. You notice the drug addiction, the cocaine, and so on. Fetal problems, heart abnormalities, hemorrhage, and so on. So this is pretty much, it's a little tiny list, but it still kind of works because there's the jaundice. If you go on, there's the meconium and so on, but we're going to work on these right now. Okay, so when you get to the fourth column on page 246, towards the end of that, not at the bottom, but towards the end of that category, you'll see where those Z codes start, okay? We have a triplet, Z38.8, born in hospital, Z38.61, or by cesarean, which still means they're born in the hospital, but they were born by cesarean section, that's a Z38.62. If they were born outside of the hospital, that means mom's in the car and she gives birth to, or she decided to have it at the house and then decided to come in. Then you have a code for that because the baby technically was not born in the hospital, but it does state born outside of the hospital. Okay, so you have a few of those codes there. Okay, guideline 1.C.16.83, use of codes from other chapters, with codes from chapter 16. So codes from other chapters may be used. So of course you're gonna tell the baby story, okay? Like I mentioned, not every code is gonna be a P code. Okay, so you can have P codes along with regular codes. Codes for signs and symptoms may be assigned when a definitive diagnosis has not been established. If the reason for the encounter is a perinatal condition, then that code from chapter 16 should be sequenced first, okay? So again, let me see if they have, I'm not seeing fever in here. Okay, so if fever's not a P code, then you can pick up the fever, right? That's most common. Child's coming in for fever or vomiting or things like that. Guideline 1.C.16.8.4, use of chapter 16 codes after the perinatal period. Should a condition originate in the perinatal period and continue throughout the life of the patient, okay, they're still being followed, and more than likely they'll be going down here, they'll be going to Driscoll to be followed up for whatever condition they have, then the perinatal code should continue to be used regardless of the patient's age. Okay. Guideline 1.C.16.85, birth process or community acquired conditions. If a newborn has a condition that may be either due to the birth process or community acquired and the documentation does not indicate which it is, the default is due to the birth process and the code from chapter 16 should be used. If the condition is community acquired, a code from chapter 16 should not be assigned, okay? And then for COVID-19 infection in a newborn, see guideline I.C.16H. Okay. Let's pop up the 3M because I'm curious about, I ain't seen no newborn with COVID yet, but oops. Let's see. Let's pop up this 3M because I'm curious about newborn with COVID. It doesn't matter if it's a male or female. COVID does not discriminate. You can put 0 for the age. And And on the code finder, just put the DRG finder for that. I cannot change this in Medicare, okay? We'll just put that they went home. And then, let's see what happens if I use that. It doesn't say anything about a newborn. Oh, there it is, newborn. Okay, so what I did was I just put in COVID. Anything and everything with COVID is gonna pop up. Okay, so I'm looking for newborn. I just put continue list. And on the second list, we have a newborn testing positive. Let's see what the rules state here. When coding the birth episode in a newborn record, assign the appropriate Z code. So if they had been born and then got tested and had the COVID, then you know that the Z code for being born goes first, and then after that you'll put the other codes. For a newborn that tests positive for COVID-19, assign code U071 and the appropriate codes for the associated manifestations in neonates or newborns in the absence of documentation indicating a specific type of transmission. Because I know that when we had like COVID everywhere, that the baby might have got it from the mom that was COVID positive, okay? So for newborn test positive for COVID-19 and the provider documents the condition was contracted in utero or during the birth process, assign codes P35.8, other congenital viral disease, and U07.1 for the COVID-19. So,
And the P code would be first and then the U code?
yes. Because remember the rule, one of our rules states the P codes will go first. So kind of like with the mommy code goes first and then the COVID code, well, here's the same thing. P code first and then the U code, okay? I do recall a case that my daughter had where she literally scrubbed in and she looked like, well, she was wearing a hazmat suit because the lady was having a cesarean section and she tested positive for COVID. So she scrubbed in and, you know, she assists the doctor because she's doing her microbiology now, but she was a surgical tech before and she did 4 years at DHR with all sorts of cases and mommies and babies, right? So, but I do recall that time that she only had one case where the mom was pregnant and they were worried about all that, right? But anyways, I don't recall her mentioning anything about the baby getting it, but I do recall the mom had it, so you're gonna see all sorts of things. Let me see, let me go back.
Wouldn't the baby get the antibodies from the mom if she was sick?
And that I do not know. So I just put newborn, right? So we were just reading the information. Sometimes that we're allowed to read that because we don't know everything about everything, right? So then it's either contracted in utero or during the birth process. Again, he has to state it that way. Okay, in order for you to pick up that code. If he doesn't say anything, well, I don't know. You know, for all I know, the nurse breathed on him, right? There's like 10 nurses coming into this room, and if they ain't wearing a mask, well, they should have been wearing a mask, then somebody caught something, okay? Oh, you don't even know what I read yesterday. I was like, anyway. That's another story, but that would gross me out. And it was a baby thing, too. Anyway. We learn something every day. Do you want to know? Do you want to know?
Yes.
Okay. And now everybody wants to know. Well, either I coded it wrong or it's popping up for you
If
code.
it's unspecified, it just pops up that one.
Oh,
If you
okay.
go to utero.
Okay, then it pops up the P code. Okay. So yesterday something popped up on my Google because I'm always on the Google about some babies dying up in New York because they had contracted like herpes and things like that. Well, let me tell you what. Not to offend anybody's religion, but they were Jewish, and the Jewish religion, they'll do the actual circumcision right there. The rabbi will do it. Well, not to gross anybody out, but after they cut the skin, the rabbi actually sucks the blood. I had never in my entire life, yes, it grossed the hell out of me. I had to share it with my daughter who knows everything, but she did not know this either. Yes, so I guess the old man might, because old people have diseases. He might have had a herpes virus or, those. It doesn't mean you have herpes private part, but herpes is like, the little granitos you get sometimes. Well, yeah, unfortunately, when they were sucking the blood, it got transmitted through there, and maybe they killed a few babies. But anyways, Google it. I was like, oh my God, I don't even know how I would even code that. But yes, you learn something new every day. And no, I have not had a patient come in like that, thank God. We do normal circumcisions at the hospital. Normal. None of that. Okay, but I did read that the parents have to sign up, and of course, when you're in your religion, you're going to do whatever they tell you, basically. So I'm assuming they signed up and gave permission. So,
That's a weird kink.
yeah, I've seen everything now. But so yeah, that was like, no. Okay, so now you know. Don't allow anybody to do that if you don't want your baby to catch them, I guess. Everybody's gonna Google when they get home. Trust me, I was like, what? Okay, let me see. So that was that COVID. Okay, so P code goes first and then the COVID code. Let's see. Okay. Oh, I lost my train of thought. Okay. Guideline I.C.16.8.6. Code all clinically significant conditions. Okay. So again, if baby comes in and after everything, he's got a hernia and all that stuff, we just code everything that's wrong with him. Okay. That's been documented, of course. All clinically significant conditions noted on routine newborn examination should be coded. A condition is clinically significant if it requires a clinical evaluation or therapeutic treatment or a diagnostic procedure, extended length of hospital stay, or increased nursing care and or monitoring. Again, it doesn't matter if he's been there 10 days. If he doesn't tell us, I cannot pick up that code. Okay, I cannot in good conscience just pick up anything that I read in the labs. If you do see that there's sepsis or strep or something on the labs and he's been there 10 days and we've been giving IVs, of course you're going to query the physician, because that was a lot of money that we spent taking care of that baby and we need a diagnosis for that. So at that point you would query the physician. Again, we never lead them. You'll just say, I read this, or I saw this lab, and they'll, honestly, we have CDI people that will tell us how to write these out, because honestly, everything's being looked at, and they're gonna come back and blame us for picking up something that we weren't supposed to. So yeah, I would make sure that somebody reads your query before you send that out so that you're not leading. But most of the times for inpatient, the queries are already in there. You just have to click on the one that is the one that will go with your scenario and then take it from there. Now, you will have a doctor that says he doesn't want to answer it. You cannot do nothing about it. You will never, ever ask him again, and you just code whatever's there. Okay, but trust me, somewhere down the line, they're getting education from somebody stating that if you don't say it, you ain't getting paid. So trust me, they're going to say it. Well, we hope they're going to say it, but once in a while, you'll encounter a doctor like, why? I remember this doctor, God bless his little soul, he passed away already, but ya está viejito. He was a cardiologist. I think it was one of the cardiologists. Anyway, he would just put the name of the operation and sign. I need an op report. Like, I need to know what you did to this patient because I can't pick it up. I'm just like, okay, anyways, those were the good old days when we had records. So, but even then, you should see all the charts that I have on hold, because how hard is it for you to sign your note? So if they don't sign the note, especially at where I work, it doesn't populate a charge, because we need a note, right? To give charges, right? Because we're just not gonna charge a level 1 or a level 2 or whatever, a 99281 or a 99282 or whatever. So anyways, that's CPT, guys. You should know that already. You should know, or you should be learning that. But anyway, so yeah. So make sure their little notice sign and pick up whatever's on there. And if you have, you'll know once you start doing inpatient, you'll see all these x-rays and things being done and you're looking at the diagnosis and you're going, no, you'll know. I know you'll know. So, but anyway, so yes, all these tests and everything, we gotta have at least a lot of conditions in there. And don't forget, if it's like an adult patient, like if they have hypertension and diabetes, that could affect their stay too. Maybe they can't control the glucose or something, or that blood pressure just can't get it to go down. That could extend length of stay too. So to make sure he's set. Okay. Especially if they're giving, medicine for that, and if they are testing, like with the glucose, they're testing you every hour to make sure it goes down. Okay, so we're covered. Note the perinatal guidelines listed above are the same as the general coding guidelines for additional diagnosis, except for the final point regarding implications for future healthcare needs. Codes should be assigned for conditions that have been specified by the provider as having implications for future healthcare needs. So, like if your baby was born with a heart problem, you're going to have a follow-up with a cardiologist, and then maybe they'll have surgery, and then maybe they'll just have to keep going like a regular patient. You go every year to see your cardiologist and make everything's okay, But with babies, it's different. You probably have to go like every month, but. Guideline 1.C.16.B, observation and evaluation of newborns for suspected conditions not found. Okay, so we have observation codes for that. Guideline 1.C.16.B.1, use of the Z05 codes, assign a code from category Z05, observation and evaluation of newborn for suspected diseases and conditions ruled out, to identify those instances when a healthy newborn is evaluated for suspected condition disease that is determined after study not to be present, okay? And do not use a code from category Z05 when the patient is documented to have signs or symptoms of a suspected problem. In such cases, code the sign or symptom. So basically, sometimes where I do use that Z code a lot is, let's say you're the mom and you're driving your baby's in the back of the car. He's buckled up and everything, but somebody sideswipes you. Or the first thing is, oh my God, my baby, right? So you're gonna rush to the ER. He's out, he's fine. There's nothing wrong with him. So we have a Z code. We have a Z code that states observation for being in a transport accident. There's nothing wrong with him. So technically, we don't have like pain in the head, but anyway, if he did have pain, we're not gonna know because he's a baby, right? But if there is nothing else, but they were in an accident, then that's your Z code. So let me show you on the 3M, so you can see what that looks like. Let's see. Did I leave my little 3M up? Probably hiding here somewhere. Okay, so you can just put the 0. No, we don't have a P code for this one, but it's a universal code. It can be used on an adult or anything like that. So you'll just put observation. Okay. Then notice all the different things that will pop up. I mentioned that he was in an accident, so we would use the first one, but notice all the different things that could happen. Let's see. What a G. Okay. Here we have newborn for suspected diseases or conditions ruled out. That's if that was that case, but I did mention that our patient was in an accident. So was the accident at work? Again, it could apply to an adult or it can apply to a child or anything, or anyone. So at work, I mentioned transport, and that's it. They didn't find anything else. Your baby's healthy, ma'am. You can go home now, So we have to have a code. Okay? If your patient comes in, there's always gonna be something. Okay? So you're gonna have to think outside your little box and find something. So this is my go-to. If I can't, there's nothing wrong with this person, I'll just use the observation code. They came in, but they didn't find anything, right? Because sometimes patients do come in thinking something's wrong, and there's actually nothing wrong, okay? But,
So it's not the 005? Because in the book it says 05 observation evaluation, but is this just a suspect?
well, this is for, I was mentioning they were in a car accident, but if
Okay.
you, let's see.
So this one would just be for diseases and conditions, just to be
Yeah, that's if they're thinking there's something wrong with him, okay?
Okay.
Yeah.
And then the other one would just be for the.
Yeah, the other one was just something, so notice here for the newborn, it says newborn observation for suspected diseases. So if they think he's got a cardiac problem, right? Let's just use that one since it's the first one. You can click on that. So observation evaluation of newborn for suspected cardiac condition ruled out. So maybe she thought he had a heart problem or a heart murmur, or my family has heart murmurs, and I want him checked out. But he has no symptoms. Does that make sense? He doesn't have chest pain. He's not tacky, things like that. But out of concern for her newborn, she's or the doctor will actually, if he knows there's some kind of history in your family, like from what I've seen, if the family has diabetes history, right away they're gonna check for that. Make sure baby, start off, because a lot of kids have that type 1 now. So they're gonna run tests depending on what your history is, the mom and the dad. Does that make sense? Okay, so if they thought they had that condition, but again, they ran all the tests, they didn't find nothing. That's what that means, suspected cardiac condition, but ruled out. We ran all the tests, there's nothing wrong with you, but we still have to code it, okay? So that particular code works in a pinch, because there's nothing wrong with you, but we still have to code it, okay? And no, you're not gonna send it for query, okay? So, not that case anyway. Okay, that was that one. Okay. Guideline I.C.16.B2Z05 on other than the birth record. Okay, so a code from category Z05 may be assigned as a principal or first listed code for readmissions or encounters when the code from category Z38 no longer applies, because remember the Z38 means they were born, okay? So just remember that. So codes from category Z05 are for use only for healthy newborns and infants for which no condition after study is to be present. So if they did find that the baby had, let's say that transport accident, and the baby had a skull fracture, you cannot use this because we found a definitive diagnosis. Does that make sense? This is only to be used when you have exhausted everything. There is nothing wrong with this person, but I still have to code this account, okay? And we also have an unspecified for this. If they don't specify particularly their situation, right? Because if you notice under that too, we have, we do see a lot of this. I'm not saying a lot, but since I don't have adult patients anymore, but I did used to see this, quite a bit up in Dallas. Let's see, also the assault, of course, people come in, beat up. Suicide also was something that I saw. Okay, the poisoning also, so, and again, if they just came in, no hiato nada, they don't tell you anything else, then of course, remember, we have that unspecified. We try not to use it, but sometimes we have to. It will still pay. It's just sometimes people are hypochondriac, thinking there's something wrong. Well, my mom had it, and my dad had it, well, I think I have it, but you don't have anything, okay, well, yeah, but you get those patients too, I mean. Ay, no me acuerdo del señor that would always come in every week at Valley Baptist. We had his name memorized because he was, and you will get those patients. I just don't feel good. Okay, well, tell us what's wrong. Well, I don't feel good. Okay, I don't feel good. I'm sorry, we don't have a code for that, okay? But you will see that on the record and you're already like this because you're thinking, what the hell am I supposed to code down? But you will have that type of record, so don't be surprised. You'll trust me, every day is something new. Anyway, so that's not gonna work for coders, okay? So I need to know where's the pain, or something, give me something, because yeah. I don't know, get some again. I'm like, no. And unfortunately, for some of these people that are documenting, my poor doctors, they don't realize from the coding perspective, I can't work with that. I cannot work with that. I don't even know what the heck I'm gonna code at that point, because I'm just like, okay, keep reading the record. There's gonna be something somewhere, right? Because yeah, I cannot work with, I don't feel good, because it doesn't work for us, okay? But unfortunately, I cannot send that record back. Now, if you ever see that in an inpatient, oh, you better send it back, because that definitely will not work for an inpatient visit. An inpatient visit right now is probably over $5,000. This is no test. No, actually, that's an ER visit. I'm sure it's like a $10,000 visit, overnight stay, yeah. It's very expensive, depending on what your problem is, so don't be that patient, okay? Like I tell everybody, and not to be being negative about hospitals, but you're gonna pay that bill in the end, okay? If your insurance is 80-20, okay? You're responsible for 20%. So if you can hold off, I'm not saying the kids, because with kids, it's iffy. But if you're the adult that, unless you think you're bleeding out or having a heart attack, yes, please go to the ER. But if you're just like, please wait till tomorrow morning to go see the PCP, your regular doctor in the clinic, because you just saved $5,000. I'm gonna tell you right now, because an office visit now is up to $300. This is for a patient that has never seen this doctor, but all of a sudden you're sick and you gotta go see somebody, because not everybody has a doctor. They're not established. You're gonna be paying a lot of money, and if you don't have insurance, so. But let me get off of that, because I can go into that all day. Okay. That's another problem. But anyways, welcome to our world. Let's see. Okay, so we had the Z05. Okay. Additional perinatal diagnoses, guideline I.C.16.C1. Assigning codes for conditions that require treatment, and then assign codes for conditions that require treatment or further investigation, prolonged length of stay, or require resource utilization. I read that somewhere, I think, or it's a repeat. I.C.16.C2. Codes for conditions specified as having implications for future healthcare needs. Again, if they find something, you will have to follow up with a cardiologist or with a gastroenterologist or whoever they send you to. Guideline I.C.16.D, prematurity and fetal growth retardation. Providers utilize different criteria in determining prematurity. A code for prematurity should not be assigned unless it is documented, okay? Now, sometimes they will say the baby was premature. They're not giving me any months. We do have the unspecified code. It will say prematurity, unspecified or something, right? It won't give any weeks, okay? It won't give any weeks of gestation. But usually they will tell you that he was 35 weeks, or I've had as small as 23 weeks, so they will tell you. Okay, let's see. And then again, when both the birth weight and gestational age are available, then you will have the two codes, okay? But he will state it. Yes, everybody gets weight when they go in, but we do not code from the nurse's note. Okay, we have to code from the doctor's note, so he will mention it. Okay, and that's the only way we can pick that up. Low birth weight, I.C.16.E, low birth weight and immaturity status, codes from category P07, disorders of newborn related to the short gestation and low birth weight, not elsewhere classified, are for use for a child or adult who was premature or had a low birth weight as a newborn, and this is affecting the patient's current health status, okay? And then C-section I.C.21, factors of influencing health status and contact with health services. We will cover that in like chapter 23 or 24, okay? Let's do, I think it's almost time for a break. Let me finish up these last three and then we can start coding. So then we have the guideline I.C.16.F, bacterial sepsis of a newborn. Again, as an adult, you can have sepsis. As a newborn, you can have sepsis. So that category would fall under P36, okay? Notice that additional codes that we have been using for infections, B95 for the streptococcus, staphylococcus, and enterococcus as the cause of disease classified elsewhere, or B96, other bacterial agents as the cause of the disease classified elsewhere. In this case, should not be assigned. And if the P36 code does not include the casual organism, assign an additional code from category B96. And then there are rules for the sepsis that you will learn in Ms. Martinez's class, okay? So just remember, when it comes to the strepto and all that, we cannot get that information off the labs. You'll see it because you're looking at the whole record, but he has to specifically say it. We do not code off labs, okay? But you can query, right? If he doesn't mention it again, like I mentioned, the resources we're using, that baby has been there all month. And you're just telling me it's sepsis? No, there's something that is causing this long stay. Remember the length of stay, so you should have learned that somewhere. But that, yes, we need to find out what's going on, right? And then we have the stillbirth, IC.16.G, code P95. Stillbirth is only for use in institutions that maintain separate records for stillbirths, and no other code should be used with the P95. Okay, so why wouldn't I use any other codes for the P95? Yeah, because they're dead, okay? Well, I just want you to see that, does that make sense? Yes. And I gotta code anything else, he or she is gone, so there's nothing else, you know. Then we have guideline I.C.16H for the COVID-19, and we covered that. Okay, go on breaks. Okay. Go on breaks, and I need to finish this sandwich already. Check my phone. I hope y'all do the same thing. Oh my God, I forgot to put my phone in silent with a brain. It's so embarrassed. Let's see. Stretch, guys. Stretch, stretch, stretch.
know, that's her baby back. Cause if we get a girl.
No.
I saw it, it took me. And then he did that, before that, before that, I was like, nah, I told him
Let's see. What else do you guys need to learn about this chapter? Okay, we went over that. Okay, let's see. Future healthcare needs, bacteria, stillborn, COVID. Okay, on slide 16, there's also some information about that COVID. So, let's see. What else? We discussed some of this. Okay, let's go to page, in your book, page 540. Let me see if I can find a slide for that. So we're gonna go over the weight. Okay, so, P05.1, newborn small for gestational age. It has a fifth character for the birth weight. So, subcategories within P05 are used to classify an infant that the physician identifies as light for dates or light for gestational age. Other diagnoses written by the physician are small for dates or small gestational age. So what does that mean? That just means, let's say mom is 6 months pregnant, but the baby is not as big as they expect the baby to be, right? So sometimes that's a problem because he's not growing, or she could be 6 months and he looks like he's 9 months. Okay, so either she's eating too much, that was my problem, or something's wrong with the baby. See, so everything comes back to the baby. Okay, so other physicians may use an equivalent diagnosis of fetal growth retardation known as FGR, or fetal growth restriction. That is birth weight below the 10th percentile for infants given in a population. Okay, not to worry if the baby's born, you know, like I said, especially at Driscoll's, they work with the parents. You'll be followed up, or your baby will be followed up by a nutritionist or a dietitian, and everybody is working. The goal is to get the baby back to the normal weight, right? So, so the following fifth characters are used for the subcategories P05.0, newborn light for gestational age, and P05.1, newborn small for gestational age. So we have the fifth digit 0 for an unspecified weight, 1 for less than 500 grams, 2 500 through 749 grams, 3 750 through 999 grams, 4 1000 through 1249 grams, and so on. Okay, so they, in other words, for us to pick up that code, they need to tell us the weight. Okay, so an example they give here is the newborn infant was described by the physician as small for dates, weighing 1,800 grams, P05.17, newborn small for gestational age, 1750 through 1999 grams. Okay. The alphabetic index to diseases and injuries using the main term small for dates. Okay. And that would lead you to that P05.17.
But it would have to say small for dates.
Yes, it will have to say small for dates. Okay. So then they also have short gestation and a low birth weight. So just kind of like, unless it's just a premature, then it would be that premature code, and then with the weight, whatever the weight is, okay? Go to check your understanding on 19.1, and we will work on one of those. Okay. Number 1 states, newborn affected by a prolapse cord, newborn transferred to Children's Hospital for treatment, code for the care at Children's Hospital. Do we need, was he born there? Okay, so you do not need that Z code. So we're just gonna look for newborn and look for that condition. Okay, so newborn starts at 2:45, and the problem is affected by, so you have that newborn affected by, and then we are looking for the prolapse cord. Let me pick on somebody. Who haven't I picked on? Elisa, haven't picked on you. Oh! So you went to newborn affected, it's got all those conditions, so just, they're in alphabetical order. Prolapse cord. Yes. Does everybody see where we found that? You went to newborn on page 245. Then under that, there's an indentation that says affected by, and under that has all the conditions that the baby could, well, most of the conditions the baby could be affected by. And we were looking for the prolapse cord that's on page 246 in the 3rd column. Okay. So that does not have a little dash at the end, so you know, if you verify it, it will be that P02.4 code for that. Okay. Now we're going to do one with the weight. Number 2, premature infant, 34 completed weeks, birth weight, 2,100 grams, and the newborn was transferred again. So you don't have a Z code because they were not born there. Now, what was the rule? Which code is going first, the weeks or the weight? The weight, very good. So the weight's gonna go first. Yeah, it says 2,100. We're on page 542 in the textbook, okay? So, their weight is considered low. So you will go to low. Because I don't think we have a newborn low. No, we don't. Okay. So you will go to low. We have low birth weight, and then you would look for the 2,100 grams. On page 225, 2nd column, and that P code for the weeks is P07.18. Yes?
Yes.
Okay, that's the weight. Now you have to go back to look for the premature infant and the 34 weeks. So you will go to premature, prematurity, I think it's prematurity. Yes.
Where did you get the birth weight? I can't,
Low, you go to low?
on the newborn?
No, you go low.
Just weight?
Low, yeah, L-O-W. Yeah, because if you go to newborn, because that's your automatic for new coders, it says newborn, so I would go to newborn first, and if you don't find it there, then what's his problem? He's got a low birth weight.
So it's P0737?
No, 1.8. Oh, the other code?
The first one.
Oh, the first code, no, it's P0718. Did you go to the low?
Oh, okay.
Yes, you found it?
Low birth.
Okay.
Okay.
Yeah, because when you get to the birth weight, then you're looking for the exact weight. Okay, remember the rule states the birth weight's going first. Then your second code is for the premature infant. And we're gonna pick on somebody else, okay? Anel? Yes, okay. So go to premature. Yeah, and this, yes, I will count it wrong if you transpose, because the rule states and the guidelines will always trump anything else. That the weight goes first and then the premature code goes second. Okay, so the guy, if you are hesitant about how it goes, at least for this one, you have a guideline guess. The guideline states that the weight goes, that weight code goes first, and then the second code would be the prematurity code. Okay, did you find the code? Anel, not Edward.
That's the last name.
Oh, that's your last name.
Yeah.
No, this is Anel, first name. Okay, so you went to premature. Okay, once I get past pregnancy.
276.
And then, doo-doo-doo. Okay, then it tells you, so the premature person is a newborn, and then it states how many weeks? 34 weeks, so it says newborn less than 37 completed weeks, then you have to go see preterm, okay? So then we go to preterm, that is literally on the next page, on third column, and we'll let Anel look that up. Yes? Okay. And our baby is 34 weeks. Yes. So your first code is P07.18, and then it's P07.37. Okay. Right. Go to page 545, but you see how that works there, okay? On page 545, these are some of the conditions that could affect the baby. Okay. So again, you'll notice that they are baby codes, so you will always go to newborn first, and then if you cannot find it under newborn, then you have to go to the condition that's affecting the baby. Does that make sense? Because remember I said you're not gonna have a P code for everything, okay? But if your condition has a P code, like I mentioned, I would go to, my thing with jaundice is I would go to jaundice first. And it does tell you jaundice newborn, and it does have a P code for that. But you can also go to newborn and look for jaundice. I'll give you the P code. See what I'm saying? So there's always gonna be sometimes more than one way to look for it. So don't panic, you can't find it, just figure out what the main term is, okay? So we're gonna do number 2, facial palsy. Has everybody heard of palsy? Okay, so palsy due to birth injury. So let's go to newborn, see if there's any injury codes in there. I need to tab my book. Okay, newborn affected by, let's see. I don't have any injury here. And I don't have any palsy that I can't see. Okay, so if it's not there, then our main term is palsy. Edward, I'll pick on you. Policies on page 258.
P11.3.
Yes, P11.3. So, in this case, it doesn't say there, but if it did state the Bell's palsy, you could go to Bell's because it's a proper name. You should have learned that in Ms. Martinez's class if you're in that chapter yet. And, would have found it that way. But in this case, it states palsy, then Bell's, and then it tells you to see also palsy facial because it is a facial palsy, and it's a newborn, P11.3. So you could also see also, remember the rule is the see also, you don't have to, but the see you do, okay, so. But that is our final code, thank you, word P11.13. Let's do one with the meconium aspiration pneumonia.
Miss, for that
Yes.
one,
Uh-huh.
there's one also that under policy that says, newborn birth injury, but is that for the brachial plexus?
Okay.
It's under it, right? So it would be for that one.
Okay, but our statement doesn't state, brachial,
So,
brachial plexus,
It
yeah.
would just be the palsy one.
Yeah, it would just be the palsy one. Remember that the stuff, if you remember your rules, the stuff in the parentheses may or may not affect the code. Does that make sense? You might see it worded that way, but it doesn't always has to be that way, because if that was the case, our dictation would be way longer if the doctor's gonna specifically say every single little word, right? But, in this case, it's just the facial palsy, yeah. Okay, we're gonna do number 4, the meconium aspiration pneumonia. And yes, if you went to newborn, it did mention something about the meconium, but I don't know if it's mentioning the pneumonia as the problem for, that. Okay, so, again, just so you can get used to it, you'll go to newborn. Let's see, affected by, let's see. It does say meconium, but do they have peritonitis? Okay, then. Then now you do have to look for your main term, which is pneumonia. Okay. And under pneumonia, you're gonna see a lot of things, so. Who can we pick on? They're like, no. Rebecca? Okay, pneumonia starts on 267, and we are looking for,
Is it, P24.01?
yes. Walk me through.
Pneumonia,
Uh-huh.
all the way to the M's, and I looked up, what's that, how do you pronounce
The
that?
meconium?
Yes.
And you also could have gone pneumonia aspiration, for those of you that did it that way. Newborn, because it is a newborn. And under that, they also have meconium and the same code. Okay?
Yeah.
Okay. Yay! Very good. Let's do, let's do number 3, because that one was a weird one. So, it states that the baby has conjunctivitis, and it's got that word that I probably cannot pronounce, ophthalmia, what is it, neonatorium, something like that, okay. So, you could go to newborn and see if there's a conjunctivitis in there, but if there isn't, then we can go to conjunctivitis, so. No, I don't see no conjunctivitis there.
So now we go to neonatal.
No, well, neonatal means newborn.
Yes.
So, it wasn't there, so now we're going to conjunctivitis. To see if that particular, ophthalmia is under that. Conjunctivitis due to in. Well, I'm not seeing that word there, so now, okay, cause it's gonna take you a little bit of time. Like, we don't hardly, the only time we see conjunctivitis is the baby has a cold, right, so now we can go to that main word, ophthalmia.
But the code's right there.
It is?
Yeah.
I didn't see it. N-O,
It's under.
newborn, it's under newborn?
It's neonatal.
Yeah, I saw it, neonatal. But you can also go to that ophthalmia. Let's see. This is the first time I see that word. Okay. Let's see. Most of the times it's a viral conjunctivitis or bacterial. Okay, they have the ophthalmia, neonatorium, newborn, and it's the same code. So just in case, either or will get you there, okay? Because some of you will go one way and some of you will go the other way. Okay, so those two ways, yes, P39.1 was code. Now let's go over to check your understanding 19.3 on the newborn codes, which were the Z codes. Okay. So we're gonna do number 2, newborn, twin female, born in hospital by cesarean delivery. Main term, newborn. And it was a twin. So you'll go to newborn, twin, and born in hospital. Okay, because remember you have either born in the hospital or born outside of the hospital. Yeah, but you wouldn't have, if you think about it, you wouldn't have a cesarean outside of the hospital, but just so you can see the process.
Unless you're Jewish.
Well, you never know if the the EMT.
We watch Grey's Anatomy.
Yeah. I've never watched that show. I don't know why I just couldn't get into the fake show. I guess working at the hospital, I'm like, this is so fake. Anyway, I'm watching a new one on, I believe is it NBC or Fox, where the doctor, she was in a car accident. She lost 8 years of her life, meaning she's not a doctor anymore. Yes. She still remembers being a doctor, but because she hit her head, and it's based on a true story. But I think the real person was a guy, but in the movie they put a girl. But yeah, she barely went to go take the state boards because she had to retake them again to prove that she could work because the fact that she had lost 8 years of her life. That's crazy, right? Anyway, I'd be like, I don't want to take that test again. Okay, and then cesarean delivery. So it's Z 38.31. Okay, so, and you'll see that we also have the triplet. So we're gonna do number 3 for the newborn triplet male born in hospital by cesarean delivery. Let me pick on Kayla.
Is it C 38.62?
Yes. Yay. Okay, so you see the process for that one. Okay, let's go into the review exercises. Number 1, a 20-day-old infant, which is also newborn, was admitted with Streptococcus group B sepsis. Okay. So I believe that, I think I saw that under newborn. If not, you'll go to sepsis, okay? So remember, not everything's gonna be under that newborn, but it could be. That's, looks like it's one of those, it probably is. Let's find out. Newborn affected by sepsis. Is it?
Yeah.
Okay, sepsis on page 246, last column, kind of on top. And we're looking for the Streptococcus group B. Elizabeth, they already picked on you? Or you already picked on you? No, okay.
It's P36.0.
Yes, P36.0. Let everybody see how we did that. Okay. If it wasn't there, then you would go to sepsis and you could look for it that way too. Okay. How are we on time? Oh, we're good. Let's do one that has the newborn code so you can see how that is. You don't want number 4. It has 1, 2, 3, 4, 5 codes. That's a big fat no. Okay. Let's do number 5. It has 2 codes. It has the delivery newborn code and then the baby's problem. Okay. Number 5, full-term newborn infant of a diabetic mother syndrome. Remember, we don't care what mom's problem is, but if it's affecting the baby, then it is a problem. Okay. So, again, this is the baby's record. Baby was born by cesarean delivery in the hospital. Mother has pre-existing diabetes. Okay, so we're going to look for the newborn code first. Because the rule states that if he was born, that is your first code. Okay, so be careful how you're sequencing your P's. Because if you put the P first, this is going to be automatically wrong. If they were born, you automatically put the Z code. Put that somewhere in here, or write it down, or highlight it. Okay, if they were born, the Z code goes first. Okay. So I'm going to give you the Z code, Z38.01. The baby was born in the hospital by cesarean. Okay. Then what else is the baby? The baby's mom is diabetic, which means the baby might be, I guess, but in this case, they're associating it with baby being affected by the mom. So you're gonna go to the newborn again, in the same area, but you're gonna go newborn affected. Let me get there. I should just mark that page. Okay. Newborn maternal complication. Okay, so that is something I do see a lot at work. Okay, so under maternal complication, we are looking for the diabetes. Okay, so you'll notice if you have a mom that's alcoholic, the code's there, she's on amphetamines and so on, okay, but our baby is, being affected by mom being a diabetic, and it states in the scenario pre-existing diabetes, meaning that mom had it before she got pregnant, okay? And so that code is P70.1. Now you gotta verify, but that is the code. So your first code Z38.01, and then P70.1. Does that make sense?
Mhm.
Okay. Now let's do one that just has the P codes. Go to number 6. Newborn transferred. So do you need a Z code? No, because the baby was transferred. Okay. Transferred to Children's Hospital after birth at a local community hospital. The reason for the transfer are grade 1 intraventricular hemorrhage. I have seen that a lot in my patients. Birth weight of 1,800 grams and 32 weeks of gestation and a premature infant. What is the main problem for the baby? Right, yes, the hemorrhage. Okay, so here again, sequencing issues. Okay, the hemorrhage is going to go first. This is the reason why he's being transferred, not because he's a preemie, okay, but because he's bleeding. Okay, so that's going to be your first code. Then you'll have the weight. Remember, the rule states that the weight goes before the premature code and then the premature code. So you'll go again to newborn affected by, and you should find that hemorrhage in there. Okay, what does it state? Intraventricular. It's a grade 1. So when you go to newborn affected by intraventricular, notice how it has non-traumatic in the parentheses, okay? Had they accidentally been sliced or something that the doctor did when he was cutting, right? Or they had a vaginal and they pulled them out, you know, and used the forceps too hard, then it would have been a traumatic. But in this case, he's just bleeding. We don't know what happened. It happens. And he's a grade 1. Alondra, code? Yes. First code is P52.0. Then we'll go to get the birth weight. And remember, somewhere in your notes, put low so that you know to automatically go to the low. So you can get that second code from there. Low birth weight, and the baby is weighing 1,800 grams. Anybody? Yes, P07.17 is your second code. And then your last code is the premature code. And the baby is 32 weeks. Anybody? I know some of you might have done the homework already.
P07.35.
I told you, I knew it. Okay. So if you went to premature, you're gonna look for that code, preterm, or it'll tell you to go to preterm newborn and then get that. Okay. So final codes, P52.0 for the hemorrhage, P07.17 for the weight, and then the P07.35 is for the 32 weeks of gestation. Okay. So notice that even though it's 32 weeks, it doesn't say P0732, so be careful with that, okay? It's not going to match. Okay, like with the weeks of gestation and the pregnancy, that matched. in this case, it doesn't, which I find very weird because while I'm coding, I'm like, but that's how it is. Okay. Let's see. Let's do number 15. Because in this one, you will have to have a B code for the second code, okay? 15, a 21-day-old infant. How many days do they have to be in order to be considered prenatal? Very good, 28. So a 21-day-old infant readmitted. So was he born here?
Yes.
Was he born here? It says readmitted. So when he was born, he left, and then maybe he was having problems peeing or hematuria or something, and mom brought him back, so he got readmitted.
So there would be a Z code?
No, because was he born on this, readmitted means he got admitted again, so he already left, he was born on the first, okay, but be very careful, so that's why I'm letting you know. So he got readmitted means that he went back to the hospital again for this now. So he probably did not have, he probably did, but they didn't, no, they probably would have realized because they would have ran all those tests. So maybe a week later, well, he's 21 days, so what, 2 or 3 weeks later, he has the UTI. So think about that. Remember, it gives you the days too. So it's not a 0-day-old baby that just got born, or 2 days later, because if she had a cesarean, they might let her go 2 days later. So this is 21 days. No, the baby was not born. Okay, so no Z code. So you can go to UTI, but I think it's best if you go to newborn and look for that urinary tract infection. Let's see if it's in there.
I don't see it.
It's not in there? Oh, okay. It's got everything else in there. Noxious, nutritional, placenta. No, it isn't. Okay. So go to infection.
And then we're gonna use the B code, right?
No, the B, first you gotta get the P code and then the B code. So you have infection, urinary, and in parentheses it's got a tract, and then who's got the problem? The newborn, right? Okay. Anybody?
P39.3.
Yes, P39.3. That is your first code, but if you were to verify it in the tabular, it will tell you that you would need that B code, right? Because you have an actual bacteria or virus or whatever growing, okay? So now you're still in the same area, but you'll go to infection and you'll look for that E. coli. Well, actually, bacteria, E. coli. Bacteria, E. coli. You're still under infection, but now you're looking for the bacteria. Okay. So you have infection, bacteria on page 193. On the second column, we have under bacterial, it's got not otherwise specified, but ours is specified, right? As cause of disease classified elsewhere, which is the case with this. And then it's the I don't even know how to say it. I always say E. coli. Escherichia or something like that. Coli. Trust me, the hospital says E. coli because nobody can say that word. Okay? And it's got a B96.20. Okay. And that's it. P39.3. And then the B96.20. Okay? Because it states due to E. coli bacteria. And like I said, most common are that E. coli, the staph or the strep. The staphylococcus is usually the MRSA or the MSSA or something like that. Ooh, okay. Alrighty guys, that's it. You only have one assignment that doesn't really have any coding in there. It has more like I was telling you what prenatal and all that means. Oh yeah, I have to tell you what's on the test. My bad. You're like, please, miss. Okay, hold on. Calm down. I'm sorry, I was looking at the time and I forgot about the time. Okay, hold on. Let me see. Okay, what is on the test? Okay, so it's chapter 18. Okay, so turn to chapter 18 in your book. Yeah, in your textbook. So you definitely want to know, for your procedure, the manually assisted delivery. Remember, literally you look up that delivery code and it takes you right to the code. So you shouldn't have any problems with that. We discussed that on page 531. It was one of your scenarios. So you will have that in there. You will have an ectopic pregnancy. Remember, that was the egg or the baby on the outside of the fallopian tube. If you don't know what it is, then look it up. You will have a scenario with the preterm labor. Let me see if there's a scenario with that in here. Pregnancy.
Preterm labor?
Yeah, preterm labor. I don't see it in here, but it should be in the scenarios. Let me see if I can find it. Okay, preterm starts on page 524. So there's a little section on that for you to read and look over that. You'll have postpartum scenarios. Okay, you had a few of those. On page 525, it's got some, check your understanding, has some of those there. So remember, that's the 6 weeks after the pregnancy, so that's considered puerperial or postpartum. You will have pregnancy complications, so placenta previa. Pregnancy complicated by UTI and vomiting. I think that was one of your scenarios. Too far, hold on. Another procedure code, let's see. The cesarean delivery. So on this one, I want to make sure, this was number 16 on page 531. Your scenario says hi, but you need to remember that I like to change my scenarios. So make sure you read, because there's at least 4 different ways that delivery can go. Gestational diabetes or pre-diabetic. So be careful with that when you read that diabetes patient. And it will have the weeks of gestation too. So remember, the mommy code goes first and then your weeks of gestation. You will have a hypertension. Again, it could be gestational or it could be a pre-existing condition. you will have that multi-gravitar code, and the rule was that the mommy code goes first, and then that elderly code, or that mommy being an elderly goes second, and then of course your weeks of gestation. And then you might have a patient, again, like I mentioned, with a UTI or abdominal pain or anemia or something like that. So just remember that there's usually a mommy combination code, and then make sure when you verify it, it will let you know whether or not to pick up that code, right, the extra code for more like with the one of the scenarios that we had where they had the mommy hypertension code, but you also had to pick up the hypertension. Just be aware of that. But again, it'll be like A, B, C, or D. And of course, I more than likely will give you a procedure for your bonus question so that you can look that up. Great, thank you.
And this was for next week?
Yes, the test is next Thursday, and your
And we're gonna have class after that.
yes. So make sure you read over chapter 20 for the congenital. It's also very tiny, just like the newborn section was. Super tiny.